Well, governments around the world continue to close their countries' borders. Travellers from outside the EU being turned away from airports and borders after it imposed a 30-day ban. And Germany's Angela Merkel has just said this. Let's have a look at the quote. "Not since World War II has there been such a challenge to our country that so much relies on our universal solidarity." Right, let's go to take a look around. Lots of pictures coming in from all around Europe. Let's start in Belgium. This is Ghent. Doesn't matter what time it is, it's empty out on the streets. The country there is now in lockdown. People can only go outside really for essential shopping and exercise. This is France. You can see the strong measures here. Police actually checking the paperwork of people who are moving around in public. That's after France announced its nationwide lockdown. Similar pictures. This is Athens, Greece. Normally very busy, but all retail stores are shut. And you can see the lockers coming down there. And the Venice canals, famous for being polluted, but since Italy has stopped tourists coming in, the water has become a lot clearer. OK, let's stay in Italy. It's still the worst affected country in Europe. Now has more than 35,000 confirmed cases and nearly 3,000 deaths. Today, it's reported 475 new deaths, which is the highest one-day toll of any nation. Here's Seema Contecha, who's in Rome for us.
8,000 people have been fined for not abiding by these restrictions that were put in place over a week ago, preventing people from moving around the country freely without good reasons. People have to fill out a form if they do move, saying why they are moving. They need good reasons, whether they're medical reasons, going to work, or maybe going to get some groceries. And we've had BBC colleagues in previous days being stopped by the police, and police asking to see that documentation and then interrogating them about what their purpose is here, why they're covering the story, etc. So a real sense of police wanting people to stay in.
Well, the United Kingdom has stepped up its restrictions. Schools in the UK will close by this Friday to prevent the further spread of the virus. Here's the British Prime Minister, Boris Johnson.
We also need to keep the NHS going and to treat the rising number of cases. So we need health workers who are also parents to continue to go to work. And we need other critical workers with children to keep doing their jobs too, from police officers who are keeping us safe to the supermarket delivery drivers, social care workers who look after the elderly and who are so vital. We therefore need schools to make provision for the children of these key workers who would otherwise be forced to stay home. And they will also need to look after the most vulnerable children.
Well, thousands of people who were stranded in Austria after Hungary closed its border have begun to cross into Hungary. The Budapest government opened a humanitarian corridor in a one-off move. Nick Thorpe is there at the border.
These have been mostly Romanians and Bulgarians stranded for a day and a half. There was a window of opportunity during the night. The Hungarians said Bulgarians first, then Romanians could drive across that border for 4 or 5 hours or so. That was not enough to solve this situation. And finally, after many more hours of frustration for all these people stuck on the far side of the border, just soon after noon local time, the Hungarian authorities finally allowed the Romanians and Bulgarians to pass. But I understand there's still an element of chaos on the far side, on the Austrian side, because Serbs, Ukrainians and other nationalities are still being turned back.
Well, France has been on lockdown since Tuesday. More than 260 people have died and there are over 7,600 confirmed cases. Let's see what the President Emmanuel Macron has been saying. He tweeted to the healthcare staff specifically, "You are not counting your hours in the face of this unprecedented crisis. We know what we owe you and we will do whatever it takes to help you." Well, let's go to Hugh Schofield now, who's in France for us. Hugh, good to see you. We saw pictures a short time ago of police out on the streets checking people's papers as they work around. These sounds like very strict measures. Are they working?
Oh, yeah, they're working. Yeah, I mean, they're checking people for the document which they have to have. If you go out, if you leave your home, you need to bring with you a piece of paper which states the reason for your leaving your home. And there are 5 permitted reasons: broadly, work, medical emergency, family emergency, or brief excursions just to take air or walk the dog or have a jog or something like that. Those are all permitted. But anything else is not permitted, and the police have been today enforcing it. Yesterday, when this all came in, I think it was more, there was a large degree of leniency, shall we say. But on day 2, or the first full day today, they have been enforcing it, and we're told that about 5,000 fines have been imposed on people for not having good reasons to go out. And the general picture here is that it's being obeyed. I mean, I'm speaking to you from the provinces. Like a lot of people, I've got out of Paris for the foreseeable future. But the same situation applies in the small towns around where I am now in central France, as it does in Paris. Everywhere is deserted. There is movement because people have to go shopping and so on, but it's very, very limited. And people are, it seems to me, for now anyway, happily going along with what the government says is absolutely essential.
OK, thanks very much for that, Hugh. That's Hugh Schofield in Sancerre there. Right, let's take a look at some more pictures coming into the newsroom, lots of them, as you can imagine. So let's start with these extraordinarily busy pictures. This is people disinfecting the market. It's in Guatemala City, disinfecting stalls, hoping to try and attract shoppers back, I suppose. Now let's go to the border between Peru, Bolivia. Peru closed its borders earlier this week. Bolivia has just announced it will do the same. Peruvians have been stranded there, essentially, as you can see, trying to get home. More disinfectant here. This is Indonesia, where officers are disinfecting areas popular with tourists. Resorts on the island, of course, are shutting down. And then let's take a look, finally, US South Korean troops sanitising areas around Daegu. That's the epicentre of the outbreak in South Korea, as you might remember. And let's stay in that part of the world, staying in South Korea, because more than 80 people have died in the country. There are over 8,400 cases. Laura Bicker has this update for us from Seoul.
Over the last week, we've seen a steady decline in the number of cases being confirmed here in South Korea, where we've had the biggest outbreak outside China here in Asia. But when it comes to the last few hours, certainly we're hearing news of new clusters emerging, not just in the hotspot of Daegu, the worst affected region in this country, but in the outskirts of Seoul. And that's what's causing concern.
Well, that was Laura Bicker there. We're going to stay in this part of the world, look at what the World Health Organization are saying, and they are calling for urgent, aggressive actions to combat COVID-19 as cases soar in Southeast Asia region. Now, cases on the subcontinent are still below 500, but there are fears a spike could, well, overwhelm healthcare systems. Let's take a look now. Malaysia, Sri Lanka, the Philippines, they're among the nations imposing strict border controls. Here's Jonathan Head in Bangkok.
Although the first case was recorded here in Thailand on the 13th of January, the numbers crept up very, very slowly. Now, some people said in some countries like Myanmar and Indonesia, Laos, for example, they just weren't doing any testing. There was a fear that there were infections there that won't be recorded. But here in Thailand, they've actually been quite efficient. They've recorded numbers, they've been testing, and the numbers crept up. That's all changed in the last few days. People were beginning to think that perhaps warmer weather was a reason that the virus was not spreading here anything like as quickly as it has done in Europe and the United States. But the numbers are creeping up fast.
To Africa now, where some 30 countries have reported cases, and South Africa has nearly 120 cases. The government has introduced a travel ban and school closures, which come into effect today. The head of the World Health Organization has urged governments throughout Africa to prepare for the worst. Andrew Harding is in Johannesburg.
In a poor township on the edge of Johannesburg, a rising sense of vulnerability today.
We don't have the drain, we don't have the toilet, 40 to 45 people using that one tap, so we must get the queue.
So if the virus comes here, what do you think will happen?
It's gonna kill everyone.
This is a world of shared toilets, of water delivered by the bucket, and no room to self-isolate.
We are going to struggle because Yeah, it's my neighbor. If I catch it, he's going to catch it. Everyone, they're going to catch it. So we are in a very big danger.
Coronavirus is respiratory droplet.
South Africa is busy preparing its defences. There are already several drive-in testing centres.
Started to just present with a bit of a cough and a slightly sore throat.
Suddenly this week, Africa as a whole is starting to clamp down, closing borders, schools, banning large gatherings, hoping to learn from Asia and Europe's experiences. This entire continent may have been given a little extra time to prepare, but it's still acutely vulnerable to the virus. The immune systems of millions of people are already compromised by malnutrition and by HIV, and many health systems are already precarious at best.
If this epidemic grows and starts impacting and establishing itself in any one of our neighbors in the rest of Southern Africa, and indeed in Central and Eastern Western Africa, we will likely see a more difficult situation to contain.
In the meantime, what to do about the daily crush? These buses, the only option for most commuters across Africa. Will this make you change and not go on the bus anymore?
If I had any alternative transport, I would.
And so a worried continent braces itself, resolute but exposed. Andrew Harding, BBC News, Johannesburg.
Well, there's plenty more on this truly global story on our website. Do give it a visit.